to a discussion of Street to Home, and this part of the discussion today will be chaired by Catherine De Nicola. Catherine is currently Acting Director of the Homelessness Research Section for the Commonwealth Department of Social Services. She has worked in a range of research, policy and data analysis roles at the department over the past few years. Prior to joining DSS, she worked in research and policy roles in the community sector, where her work focused on homelessness and youth. So Catherine, over to you.
Thanks very much, Andrew. I'd like to begin by acknowledging the traditional owners of this land, the Kaurna people, and paying my respects to the elders past, present and future. Today we're meeting on Aboriginal land, a land that holds the oldest living culture in the world. Well, I'm really thrilled to be here today to listen to some very, very interesting and thought-provoking presentations. This session is going to focus on Street to Home programs. We're going to hear from Cameron Parsell and Chris Chamberlain, looking at national analyses of Street to Home programs, some of the challenges, limitations, successes, failures, and also more generally about ongoing supportive housing models. So I'd like to begin by introducing Cameron. Cameron Parsell is a research fellow at the Institute for Social Science Research at the University of Queensland. His primary area of research is homelessness and supportive housing. He's currently investigating the delivery and effectiveness of housing and service interventions, and is particularly interested in understanding the conditions that enable people to exit homelessness. Over to you, Cameron.
Good morning, everyone. Thanks very much, Catherine, for the introduction. Thank you also to the Dunstan Foundation for enabling me to be here. Professor Beer and Shana and colleagues at the University of Adelaide, thank you for organising it. I'm going to speak today about a number of research projects, and of course I work on these research projects in large teams, often with colleagues from the University of Queensland. There are too many to name, but there are a number of them. I'm going to try and respond very, very broadly to this question: what does the research say about street outreach and housing as a solution to rough sleeping? And there are three themes that characterise my presentation this morning. The first is street outreach, and I'll talk a lot about that. Also housing, and this idea of supportive housing. Sitting underneath these three themes, I'm going to try and present some evidence about what's worked well, what are some of the characteristics of success, what are some of the challenges, and what have organisations and programs and policymakers around Australia done to try and overcome some of those challenges. In responding to this research question, I'm going to try and weave together what I hope is a coherent narrative based on a number of research projects. But primarily I'm going to be talking based on research that I've conducted on Street to Home in Brisbane, and as it's called in Sydney, Way to Home. But essentially they're both Street to Home projects in those two large capital cities. As has been mentioned several times this morning, Street to Home was an initiative of the National Partnership Agreement on Homelessness. That's where it was rolled out nationally as a core output, but of course it was first established in South Australia, as most people in the room would know. It's intended to be in the policy documents an integrated and coordinated means to focus specifically on people who are rough sleeping or people who are chronically homeless. Often they conflate those two groups together, but nevertheless, I think we can recognise that this type of intervention is focused on what we consider to be the minority of the homeless population, or a small number of people. And it's intended to provide this integrated means of enabling people who have those experiences of rough sleeping and chronic homelessness immediate access to permanent housing and ongoing support. And these ideas underpinning this housing first, and a couple of other key ideas like assertive outreach also. And the argument for bringing these approaches in very much relied upon an international evidence base to substantiate their effectiveness. When politicians and policymakers and advocates argued for the importance of a street-to-home approach in Australia, they couched their arguments often in terms of the evidence, particularly from the United States, and particularly in terms of cost effectiveness, I'm also going to talk a little briefly about an assertive outreach project that I conducted that ran alongside the study of street to home and way to home in Brisbane and Sydney. The assertive outreach study, which is a fundamental component, this assertive outreach of street to home, I also did field work in Darwin. Now, I'm not going to talk about the field work in Darwin today because it'll get a little bit confusing and I'll confuse myself, but I think Darwin represents a really, really important example because the model of street outreach in Darwin is profoundly different than the outreach provided in Sydney, Brisbane, and also in Melbourne. So what I think the Darwin example does, it helps illustrate and amplifies the unique and specific characteristics of assertive street outreach in the Brisbane and Sydney programs where I'll talk about mostly today. It was also very, very apparent in this research that we conducted that supportive housing, this idea of housing and support, was some of the real limitations or challenges or gaps in our knowledge, both at a program level and also a research level. So in the last slide this morning, I will speak very, very briefly about two studies that I'm involved in now, looking at models of supportive housing around Australia. But the main two studies which I'll speak about, the FAXIA-funded studies, they involve longitudinal analysis, qualitative interviews to understand the processes of implementation, and also observations of outreach service delivery. I'm going to not speak an awful lot about the quantitative outcomes data. My colleague, Professor Chamberlain, is going to speak a lot about quantitative data with reference to his presentation on Melbourne Street to Home after me. So I'm going to talk more about some broad qualitative and practice and policy themes coming out of the research. And I'm very happy to take questions on some of the quantitative data afterwards if people have an interest. So what was really, really key in the policy documents and also the practice of street outreach in these street to home programs were these two key concepts, purposefulness and persistence. And this idea that street outreach had to be purposeful was embedded in the idea that street outreach was not about building relationships with people on the street. It was not about providing harm minimisation services. It was not about addressing some of their day-to-day immediate needs, as important as all of these types of things are, but rather street outreach was fundamentally focused on providing an immediate mechanism for people sleeping rough to get out of the streets and get into housing. That was the idea. It was also meant to be persistent, and this idea of persistent was somewhat controversial. Some people described it as a move away from a social work perspective, and it was the idea that street outreach workers should not take initial refusals to engage with the service as the last answer, but rather street outreach workers should persistently endeavour to engage with people sleeping rough. And this was premised on the idea, it was acknowledged in the white paper, that many people who sleep rough may face a range of historical and personal and social barriers to initially engaging with the services, and the services need to be persistent on that basis, recognising the challenges. It was also very, very importantly, in the Brisbane and Sydney context, meant to be ongoing, and indeed it was. Street outreach is something that happens 7 days a week and for up to about 14 hours a day. In Brisbane, in addition to this purposeful idea of street outreach providing a means for people to exit homelessness, overnight street outreach was also about going into the city and the inner city urban areas and people that they had already assisted to access housing, providing a transport back to their housing for them. It was this idea based on early intervention and particularly working with an organisation called Murray Roch. It was about keeping Indigenous people who were on the streets drinking and socialising, who did have houses in the suburbs. It was about getting them back in there so they didn't get into trouble, so they didn't get arrested, and also so they weren't these hotspots building up as the service providers referred to them. And also, as Roseanne Haggerty mentioned this morning on the video, Street to Home was very much focused on vulnerability, and both programs in Sydney and Brisbane used this tool called the Vulnerability Index tool, which was developed in Boston in the US and adapted to Australia, and it essentially identifies who is most likely to die the soonest, and the intention is that services will be directed toward those people deemed most vulnerable. Now, we're really interested in this research based on critiques from the United Kingdom and elsewhere in the US that this type of street outreach wasn't just a mechanism of clearing the poor from the streets. It wasn't just about a paternalistic or a coercive move to get people out of the way. So we're really, really interested to see whether these social objectives actually played out on the ground. And what we can say, in contrast arguably to Darwin, in Sydney and Brisbane, very much there was no evidence that it was a punitive or a coercive type of approach. Importantly, however, what was fundamental for this persistent and for this purposeful approach was the capacity of street outreach officers, street outreach workers, to be able to ensure that housing was a part of the proposition, was a part of their engagement. And that is, when they were able to offer people sleeping rough access to housing, there were actually great outcomes in terms of the way that they could engage with the service users. We found in the first year in Sydney there was actually very limited access to housing, and in turn the assertive street outreach workers had a very limited capacity to actually be able to be persistent and purposeful because they just didn't have the resources to back them up. And what we found was that when they were able to have the resources, the housing resources to offer people, rather than being a punitive or a coercive or a disempowering process, by making these types of housing resources available to people on the streets, these people were able to exercise choice and autonomy and self-determination. It wasn't simply a matter that they had sleeping rough or problematic homeless accommodation to choose, but rather they also had the option of secure tenancy. And these kind of options enable people to exercise that autonomy. Very, very important, people on the street were not passive service recipients. It was not a question of street outreach went out there and did the intervention on the people, but rather there was a very interactional and dynamic relationship between the street outreach providers and the people who were sleeping rough on the streets. And this is really, really important because there's often an argument or a notion that some people on the streets are actually not ready to engage with a service. And indeed in Sydney, we found that a number of young people who had active addictions really found it hard to work with the service. But nevertheless, what our data shows is that rather than assuming that people are not ready to engage, we need to understand their situation, understand their reluctance for engaging, and ensure that the intervention is flexible and caters to their needs, to their individuality. And what we saw, speaking to a man in Sydney in his 60s who was assisted to access housing after a number of years on the street, he spoke about initially being reluctant to engage. He described himself as a shearer's cook in his early days, someone who wanted to be seen as a kind of a tough guy who was in charge of his own life, and he felt very vulnerable when these young, particularly female street outreach workers wanted to help him. He wanted to get out of the streets. He spoke about his fear of being on the streets and the danger, but he didn't want to let go of his autonomy or his sense of self by engaging with the service. So the service needed to be very, very clever, and the workers particularly skillful to engage with this man to get him to access housing in a way that didn't undermine his sense of self and this idea of himself as a shearer's cook and quite a guy who took pride in his identity. Unfortunately, however, what we saw in the early stages of implementation, despite the policy intention being an integrated means of street outreach, housing and support, and despite street to home being linked to objectives of reducing the number of people who are homeless and providing immediate access to housing for vulnerable rough sleepers, and despite these street to home programs in both of these cities actually being administered by their respective departments of housing, there was very, very, very little planning or thought given to how housing would fit into this puzzle. At least there was very, very little thought at a systematic and policy analysis level. It was very, very interesting when we interviewed workers from the Department of Housing, and they said, yes, housing wasn't very well planned for this, and it was their housing that wasn't planned in an organisation that they were running, a program that they were running. There was no sense of whether there was going to be public housing quarantine for people who were clients of Street to Home. There was no sense, or at least there was a very, very clear sense from many Department of Housing workers, I think very, very rightly so, that well, we have lots of people who are priority access. We have lots of very, very marginalised and vulnerable people. On what basis should we be giving these people who have all of a sudden come into our waiting list on the basis of this Street to Home status priority access? There were very, very little mechanisms in the early days to enable that access to housing, that housing first kind of philosophy. What we did find, though, despite some of these early systematic issues, and I really will emphasise early because in many respects some of them were overcome as these programs rolled out, there was a very, very successful campaign in Brisbane, a public and political campaign ran by the organisation that delivers a street-to-home program, and it's called 50 Lives, 50 Homes. And they got the local member on board of the inner city area, who happened to be Anna Bligh, the Premier, which in turn got a lot of other community organisations and the media on board, and all this kind of groundswell of public sentiment behind this 50 Lives, 50 Homes initiative, which was also running parallel to Street to Home, meant that people got access to housing, but not through systematic ways, but through ad hoc ways. In Sydney, on the other hand, there was a real discontent about the numbers of people sleeping rough, publicly visible in Woolloomooloo, a very affluent gentrified suburb, and also around the library and the Parliament House. And this discontent, coupled with a recognition that governments were spending millions of dollars on this way to home program, led to quite an innovative approach to get housing. And this innovative approach recognised that the social housing system actually wasn't going to be very responsive to this way to home program. So they developed something called Platform 70, which was essentially a bucket of $3 million, which enabled a community housing provider to go and head lease stock from the private sector to enable these people to get into housing. Also, the Nation Building Economic Stimulus Plan came on board, and there were lots of, relative to the numbers we're talking about in the couple of hundreds, there was lots of new stock coming on board, and that stock was a really, really great exit point for many of these people. We interviewed a lot of people in their brand new apartments that had just been built with stimulus money. Very, very, very briefly, what we found, of the 77 people in our research in both cities who were able to engage in our research at the round 1 phase and then 12 months later at the round 2, recognising that we lost some people through to death and incarceration and just going missing. We had 77, and we found that 76 of these were actually sleeping rough at the time they engaged with the service. So the service was, on that respect, working with who they were meant to be. 62 of them were assisted to access housing soon after entering the program, anywhere from a couple of days to about 6 months, depending on when the organisation could get housing. And we can see that the overwhelming vast majority of people were able to sustain housing over time. And this is really, really important because it's not just about was Street to Home able to get these people into housing, but it was about who were the people that they were working with. More than half of the 77 people described experiencing more than 5 combined years of rough sleeping in their lives. Just under half said that they first slept rough before they were an adult. Everyone was disengaged from the labour market, and only 2 people at round 2 were engaged in the labour market. So it was a very, very marginalised population who were nevertheless sustained housing. Some of the successes that the organisation... How am I going for time, Catherine?
Heaps.
10 minutes, cool. Okay, I'll start to speak more slowly now. Some of the important successes we wanted to know, okay, so there were challenges in getting housing, but through a number of political and community development activities, housing was able to be sought. So we're very, very interested at the 12-month follow-up point. What were some of the factors that explained people getting into the housing? So what helped for the people who were formerly rough sleeping to get into the housing, and what were some of the factors that explained why they kept housing after 12 months? We're interested to know that. Removing barriers was a fundamental key area, and removing barriers were the barriers that the Department of Housing or the legislation put up. They were barriers to people getting on the wait list. In Brisbane, for example, the street outreach workers, recognising that it was going to be very unlikely that these people were going to go into the Department of Housing and fill out application, carried iPads around with them where they sat on the street or in the park and they filled out the housing application with a person. There are also a number of requirements that people needed to have a birth certificate to register for public housing. They changed the rules so that people's Centrelink identification was enough for them to get on the public housing wait list. Also, in order to get very high priority access, people need to go and have medical appointments and have medical substantiation of their high vulnerabilities. Fair enough. But that was a barrier to getting someone on this very high priority list. So this vulnerability index tool, this tool to identify who was most vulnerable, the Department of Housing took that as a working outcome, and that they would deem somebody to be high priority based on the outcomes from the vulnerability index tool. And then once people were in housing, they would go back over and assess it more fully. So it was about removing the barriers so people could actually get on the wait list and get into housing. When we asked the 69 people that after 12 months, what things have helped for you to stay in housing? You know, what explains this? You've been homeless for years and years and years of your life, and now you've been in this house for almost 12 months. How can you explain that to us? The number one reason that people identified was the automatic rent deduction. They spoke about this rent deduction system as just them not having to worry about it. They don't have to think about these things. The money they have left was really important. And we know in Queensland at least, the primary reason for eviction from social housing is rental arrears. So this was a mechanism to minimise that source of eviction. Very, very importantly, people also spoke about a stated intention to change. When we said, well, why have you been in housing? You know, what's kept you here for 12 months? They said things like, well, I wanted to change my life. I wanted to get off the gear. I wanted to, importantly, I wanted to see my kids again. Oh, when did you last see them? Oh, 1984. You know, so there were these kind of aspirations that they really wanted to change their lives in fundamental ways. But very, very importantly, when we did the outcomes measures at time 2, we saw that there were very, very, very little changes over time. Except for 2 people that engaged in the labour market, there was no change. In terms of drug and alcohol misuse, there was almost no change. In terms of mental health and primary health, there was some very, very modest change, but essentially there were no changes. Nevertheless, in terms of how they rationalised it, this point or this perception of change in their life was really, really important. And a couple of other points about change which I think are interesting. Despite not having made these changes in their lives, despite still reporting to misuse alcohol and substances, despite still being unemployed, despite reporting low measures on health, they all sustain, or the majority of them, about 91%, sustain their housing. Continuous street outreach was also really, really important. It was really, really important because it enabled the outreach program to ensure that there wasn't a build-up of people who were sleeping rough or a continuation of them. Because of course, if street to home works very well, it will work very well for the individuals involved, but that's not to say it's going to do anything for all these other people who may come onto the streets behind them. But this continuous outreach was very, very successful, and evidence from the 2006 and then the 2011 National Census made that identified a very clear association. In the 2006 census, there were 285 people who were rough sleeping in the city of Brisbane. In 2011, there were 87 people. So there was a reduction of 198 people rough sleeping across the census. Of course, we don't have data that can point to a causal relationship, but there's a very clear association between this ongoing continuous outreach and an association with reduced numbers of people sleeping rough. 5 minutes? Thank you. Neighbourhood, when we asked the people who were able to follow up who lost their tenancies, and some people lost their tenancies in between time 1 and 2 and then got a new tenancy at time 2. So when we saw them, they were still in housing, they were just in a different house. Neighbourhood problems were some of the major barriers that people identified, either as explaining why their tenancy did not work, or when they said, when we asked them about what do you see as some of the greatest risks to you not being in this housing if we're going to come and see you in a year's time. It was very much around disputes with neighbours. Supportive housing, despite this population being targeted on the basis of high vulnerabilities and a perception that they would need support for many, many, many continuous years, there was no clear plan for who was going to provide the support, what the support was going to look like, what it was going to do. They were relying on mainstream institutions that either didn't exist, or the mainstream institutions that did exist, there was no capacity for them to engage with this client group. And importantly, because of this client group's disengagement with a lot of mainstream institutions, these mainstream institutions were not really going to provide their services in a flexible manner that was going to enable this population, now that they're in housing, to actually sustain it. And what we found is the Street to Home program, particularly in Brisbane, it just continued to provide this support, even though it was only funded for a 4-month period to work with the individuals. So what that meant is that it undermined their capacity to continue to go back and do the daily street patrols, because they were actually providing a lot of support to people in housing, and they were providing a lot of support to people in housing because they couldn't find anyone in the mainstream institutions to do it Supportive housing, what is it? Often in Australia, when we talk about supportive housing, we do in a way that's self-evident. Oh, it's support. It's supportive housing, so everything's okay. We know that there's supports in place. Who provides the support? And I recognise in Adelaide, as I've written about earlier, has the only supportive housing official formal policy in Australia. And I recognise that it's an ongoing commitment to support. But that's not the case elsewhere in Australia. Nor do we know what do they provide. We know that many of the people in our street-to-home sample require a multidisciplinary clinical team of support. The very, very successful Pathways to Housing model in New York City, a model that was cited here for the evidence base, has assertive community treatment teams that have, for example, consultant psychiatrists. There's no way on earth there's going to be a consultant psychiatrist in a street outreach team in Brisbane. There's also, you know, I've spoken to organisations who provide support and organisations that provide housing, and there's often an MOU between these two organisations. They have very, very different conceptualisations of the role of support. Rarely do the support providers see the continuation of housing as important to their mission, to their mandate. Rarely is housing, even by mental health providers, certainly in Queensland, seen as a part of a recovery process. So even when there is coordination between the support and housing providers, it's often not conceptualised in a way that we can think about as supportive housing. And also picking up on Shelley's earlier point, what is support? Is it just about providing people access to formalised services, or is it something much more interesting and creative and holistic than these types of clinical and formalised supports? And what does it try and do? Often we see that there's some discourse around, well, support's there to enable people to sustain tenancies. That seems very, very fair enough. But we also see that some types of supportive housing try to promote home and even community. Some forms of supportive housing implicitly draw on this theory of change, in that they're really trying to help people overcome barriers in their lives and achieve things that they otherwise haven't been able to achieve through housing exclusion. And this is really, really important when we think about different forms of supportive housing, either single-site congregate supportive housing, where support is very much focused on the place, or person-centred supportive housing, where it's focused on the person and it can step up and down on the basis of the person's needs. If supportive housing is meant to be a mechanism of change, if it is meant to be a means to create community, often it's thought about in the place-based type of community, which sits very well with a single-site supportive housing. But if it's meant to be a mechanism of change and people to go on and do things different in their lives, it's very, very hard to see how that fits within the single-site supportive housing. Although very, very interesting for my last point, on the evaluation of a single-site supportive housing study where there's been a very, very high retention rate of people who were homeless, who are in the house 12 months. When we talk to people in the Department of Housing saying, yes, there's a very, very high tenancy sustainment rate, they don't necessarily see that as a good thing. You know, what, so we've built this $20 million joint and all these people are going to stay in it? You know, so is this idea, is supportive housing meant to be permanent, or is it meant to do these types of things that enable people to change and they can move on and have these other types of lives? There's a real confusion about how it actually should operate and what it's meant to do, and I'm not advocating for one model over the other, but rather I'm suggesting that on the basis of the research that I've conducted across Australia, there isn't clear rationales or theory of change or purpose or objectives that are articulated. Thank you very much. Thank you.